better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Welcome back, everybody, to No One Told Me. I'm Dr. Meggie Graham, and I'm so excited to have my Instagram friend, Molly Hayes from In Good Practice on today. We literally became friends on Instagram. I think you landed in my DMs or something, and I was like, oh my gosh.
I wonder how it started. I don't remember. I was thinking about going back into social media.
What was the first message? Yeah.
We'll say like maybe even when you started following each other, but I have very vivid memories of following Untethered when I became like airway aware. And this happened back in like 2021, like long before I casually snuck into your DMs.
Well, I love it. Whatever way we became friends, I'm glad that you're in my life because
and it's weird that we haven't met in person.
It's been a while. Like some of my good, like dearest friends are becoming just virtual friends.
I know. It
but
counts very much.
Molly's amazing. I remember I was attracted to your Instagram because it was so pretty. And I remember being like, oh, it's such a nice grid. And then be like, oh my gosh, her content is really solid content and it's really educational. But that's how we met. And Molly is amazing. She is a mama, an entrepreneur, a dentist, and she is very much motivated by coming to the root cause to help patients and the public decrease risk and just be healthier. Like you're very clearly passionate about it. And I think that really enhances why you're so good at it. So yeah, tell us a little bit about how you became so focused on prevention and airway and a holistic approach, dentistry. Tell us about yourself, Molly.
Been playing this answer over in my head for like probably the last 4 hours, all through our homeschooling morning and nap time today. I'm like, what is the answer? Because it's like so many of us who ended up, being airway aware and treating airway. It wasn't linear at all. It's so disjointed actually that it only makes sense if I look backwards on it now. And even now I'm like, how did that happen? Because it was so many pieces that had to come together. So I guess going way back, I didn't love dental school. I knew from like the first week of dental school, like this was a huge mistake, but pride kept me going, pretty like in a very average, trajectory. I was not a great dental student. I was not passionate about drilling on teeth. But I just kind of figured I was just going to truck along, and figure it out as I go. Got a job, just kind of went about my way. And I had my first baby about, maybe 2.5 years after I started practicing. And I immediately did not want to do anything anymore except just be at home with her. And so I had it in my mind, like, I've never liked this. I'm going to find my way out of it. I don't know how. My husband says, well, you can't quit your job yet, but you can figure it out. And it was that time that with my firstborn, she had so much trouble breastfeeding. Like she just couldn't do it. We talk a lot about the symptoms of having a baby with a tongue tie, with like the engorgement, baby's clicking, all those things. Like, no, she really like couldn't even latch. She wouldn't. Like 6 hours went by, on her third day of life, and she hadn't nursed.
Mama and baby.
It was so scary. And so we like are scheduled anyway for that first, like 2-day-old checkup. And like I arrived an hour early, I think, in that Chicago pediatrician's office. Like she hasn't eaten and she's screaming. And this was 10 years ago to this month. And, the pediatrician's looking at her, they bring in a lactation consultant, and everyone just kind of goes, I don't know. which is feels crazy now, right? Because social media has made tongue tie a household word. But she didn't breastfeed, so I was pumping around the clock. I went back to work at 6 weeks. I was just miserable, had to give up pumping because, as we all know, that just doesn't work with
The
dentistry.
worst. It's the worst.
You did it, right?
Oh, I mean, I just feel like for several years, I was just covered in milk. I was spilling it all the time. I was like pumping on the way to work. I was just like,
Yes.
oh, I
Pumping
still
in
have,
the
I
bathroom.
hated pumping. Oh,
Yes, I needed pumping too. And so I ended up giving up. Um, so that was my first baby, and I ended up going part-time with dentistry, still kind of figuring out my path out of it. And then we had a second baby just 16 months later, and he also had a hard time nursing. And I was like, it's probably just me, right? So again, we're back to pumping, but he was different. My firstborn, she took a bottle fine. This baby wouldn't breastfeed very well. He was extremely upset all the time. Like I was like, this is colic. This is the worst case of colic I've ever seen. He would arch his back after a feeding. And again, I'm not aware of anything having to do with feeding and oral dysfunction. I just figure I have a colicky baby, and I was miserable again. And I'm due to go back to work a little bit later this time. I decided I was going to take 10 to 12 weeks. Well, at 8 weeks old, one night, we hear him like kind of having like a little bit of a wheeze. And it wasn't super alarming, but he starts kind of wheezing. And I noticed he's like a little bit colorless, not like gray, but like he kind of lost like his rosy cheeks, and something just didn't feel right. So it's like midnight, and I was like, I think we need to go to the emergency room. Something's not quite right. And so in that
oh,
20-minute drive to the emergency room, things it never occurred to me to call 911 when we were at home. It wasn't that bad. It was just like something's not right, and we're gonna just be, and I was like, we're gonna get to the emergency room and they're gonna be like, he's got like a little cough, he's fine. Well, no, we get to the emergency room and they see him, and he is like completely gray now and like struggling to breathe. And they're like, they get us in, get him on, like the cannulas, and they start like doing imaging, and he just starts going downhill in this hospital very quickly. And within about 24 hours, he actually coded cardiac arrest. Um, we were told
Molly.
12 minutes of CPR. Like we thought he was like getting ready to be transferred to one of the bigger hospitals in Chicago, and we thought he was getting ready. And they come to find us in the this like little waiting area, and they told us they were on like minute 12 of CPR. And then they leave, and Daniel and I are just like on the floor crying, like praying, please save our baby. And they come and get us again, and they're like, we probably are gonna have to stop CPR soon. You need to come say goodbye to your son. And I couldn't physically move Maggie. Like I was like paralyzed, and there was a priest with me, and the priest like grabs Daniel, and they're gonna go baptize the baby, and I couldn't move. And then there's this woman, she just stayed with me, and she held me, and Daniel comes back, and I would just thought for sure like he's gone, and his mother wasn't there to say goodbye to him. But Daniel said no, they're still working on him. Long story short, my son is alive. He's 8.5 years old, and he's fine. But it was the start of a very bizarre year in his health journey. So we end up getting him stabilized, get him to a hospital in Chicago. He goes on something called ECMO, because he couldn't breathe on his own. So they basically like took over the job of breathing for him. It's like life support, basically.
How
He
old is he? A month, you said?
What was that?
Like a month old?
He was 2 months old.
Oh,
Yeah.
God.
I know, I know. I didn't know any of this could happen with an infant. So they slowly start to nurse him back to life, and it's like a completely forward journey with like very few hiccups. And he leaves the hospital after I think like 29 or 30 days. And we bring him home, and he's so fragile. Like he's learning how to breathe again. He's got an oxygen tank. He has a feeding tube, because when they were trying to feed him a little bottle, he didn't breastfeed that whole time. That was the end of our breastfeeding journey completely. They were feeding him a bottle. The SLPs that were working with him, they were able to like watch his swallow, with like their X-ray technology, and they saw all this milk going into his lungs. So like he's aspirating on every single gulp. nothing is going in the right place. And they were like, it's probably because he hasn't been feeding. He's been on a feeding tube this whole time. And it took me several years to go back and look and say, what if that was the issue the whole time? Because we left that hospital without a formal diagnosis of like, why did this even happen in the first place? Aspiration of milk builds up in the lungs, and eventually it just came to a peak, right? But that's getting a little bit ahead. But anyways, we come home with this fragile baby, and he has to learn how to eat again. So he's eating everything through a tube, no bottle, no breast milk. And after about 5 days, he had a hard time breathing again. And so we get back to the hospital, and they're like, oh, okay, like maybe a little setback. Let's take a chest X-ray to see what's going on. And maybe they found broken bones. Like
On the
his,
CPR?
well, that's what they thought at first. Yeah. And we were like, they had said that. We're like, oh, did they tell you like that they broke his clavicles and ribs during CPR? And I was like, and we're both like, well, that was like 30 days ago. I don't know. We don't know. And so, like, okay, well, and so this is like our local community hospital. And they're like, they kind of just at this point want to like wash their hands of this and send him back to the Chicago hospital he'd been at. And so we're like, okay, fine. And Daniel and I are a little bit naive, like, okay, sure, you just want to send us back. Well, we get back down to that hospital, and they want to like launch like a child protective services investigation into us.
Like,
I know. It's the first time we've talked about this a million times, between the two of us, and there are, some newspaper articles out there with this story. So it's not the first time, but it's the first time I'm talking about it. So I might
how are you
stumble up a
doing?
little bit. But basically it did end up with a child protective services investigation, even though this child had been at this hospital for 30 days minus the last 5 days he was at home with us. And instead of anybody trying to say, well, what happened to this baby who laid here completely immobile on all these medications, ended up in this hospital most likely because of an oral dysfunction. Nobody wanted to know what happened. It all went straight to how could you hurt this baby? And so
Heart
the
is
focus
pounding.
came off of his health and off of getting him well. And it was all about who did this, which one of these parents did this. And it was 7 months in the courts fighting for both of our children to be ours again. And it was
Were they
my
were they taken away from you?
my my mother-in-law, God bless her, took on the role of their primary caretaker. I don't know what we would have done without her, Meggie. I know.
Molly.
I know. So it was and you're probably like this too, Maggie. You would have done exactly what I did. It was my only mission to get my kids back, but also to prove that whatever happened to him was medical. I just knew, there's something not right here, and I don't know what it is yet, but I'm going to find the person who knows. And I was up for like, I mean, I don't think I slept it was between November of 2017 and January of 2018 when we found a really great attorney who took our case and then was able to locate a doctor in Chicago, of all places, because that's where we were, who saw all kinds of cases just like ours where the bones during some kind of medical treatment or genetically were made fragile and would just basically break just by holding the baby. And so we hired him to be our witness. And he stood up for us and said, this is exactly what happened. This baby developed metabolic bone disease secondary to all this treatment that helped him actually get better. Parents could have done something like buckle him in a car seat, just put him in a swaddle, and that would have been enough to break the bones and all that. So we spent months trying to find that doctor, and he was just basically down the street from us. And so we found him, we won our case, got our kids back, but something didn't sit right with me. I was like, we need to be able to find the providers that we need. I didn't know that my son had oral dysfunction, that he could he couldn't swallow, whether it was a restrictive frenulum, a tongue tie, or just maybe something that happened during his birth that led him to not be able to feed well. I still don't know. But we need to be able to find the providers that can help our kids, especially. Um, yeah, that's that.
Molly,
And that was like in my mind for years before we started the directory called the Functional Finder. It was just about being able to find the right types of providers.
I don't even know where to go on this. Like, I mean, how are you telling the story? You
I
okay?
mean, I've told it many times. My first, I wanted to just kind of like hole up right after we won our case and got our kids back. I just wanted to we wanted to move. We wanted to just like kind of start over.
I can't
Uh,
imagine the trauma. I mean, the postpartum in the best
yeah,
scenario, in the healthiest, most supportive environment, postpartum is hard.
yes.
Then to have a baby and then have another baby with health concerns and then be accused of something so horrific and then not have your baby and the baby's still unwell. I just can't fathom how you process that and recover.
You know, I I think a lot of things are kind of blacked out for me. And maybe that's for the best because as you know, now I have 6 children. Clearly, it didn't scare me away too much from growing our family. It helped us to reevaluate our life, our values, what we wanted to do. We just wanted to be with our kids all the time after that. But it still was like in the back of my mind, especially after hearing the doctor. His name is Dr. Christopher Sullivan, in Chicago, and just hearing him say this happens more than you think. So it was like, do we just be quiet about it? It was kind of embarrassing. I was
Well,
practicing
yeah,
dentistry
I
at the
bet that there's
time.
probably like a shame component, even though you didn't do anything
Super
wrong.
ashamed. Exactly. Oh, but they do a really good job of convincing you that you have done something wrong. And they do a very good job of trying to pit you against your spouse because they think like they're gonna get a confession out of one of you. It's a
And
really scary
and I
system.
think you poor thing, you're still postpartum and you're still healing yourself, like physically.
I know, I know. I think about that now, but I wasn't thinking about that then. I was living on pure adrenaline, first of all,
Survival.
just survival, just get my kids back, whatever it takes. And then there was this element of like, this can't happen anymore. And so I became kind of vocal about it. And there was a journalist who heard about our story, and our lawyers after the fact were like, I understand if you want to be quiet and we'll respect that, but we know that you sharing this story could actually help a lot of people. And so we agreed to be interviewed for The Atlantic, and they ran a story, I think in 2020.
I'm gonna go search for it later. We'll drop the link to the story in the podcast note.
Yeah, I'll find it. And it was a good article. And right after that article came out, I received no fewer than 20 Facebook messages from people who found me through that article. Some people in Illinois, because notorious for, there's some hospitals there that are notorious for doing this. Couple in Wisconsin, and then
And
some
when you
just
say
really
notorious for doing this, but notorious for blaming parents or for
for blaming parents when broken bones are found instead of getting to the heart of it, is it metabolic bone disease? Is it a genetic condition?
well, and like
Just kind of this easy, like, it was they call it non-accidental trauma. So I start getting these messages from moms, and it was overwhelming, and I was like, what have I done? But also I sure could have used
falling.
somebody myself to be like, what do I do? I have no idea. I felt like in a way we were like in this weird, very exclusive small club of people who kind of knew how to navigate the whole thing with the hospitals and the courts and attorneys. And so I took a couple families under my wing, just trying to coach them through it. It eventually got to a point probably in like 2022 where I was like, I can't talk about this anymore. I can't do it anymore. And I wish I could, but there are foundations that have been set up. But then my focus I kept coming back to me, Maggie, like oral dysfunction, oral function, healthy oral function is so overlooked in babies and children, and the effects and the consequences of overlooking it are catastrophic.
Right.
And it's
And
just it's the thing that like really kept me up at night. And so I stumbled upon in like a mommy dentist Facebook group once, people talking about appliances like Healthy Start and guided growth appliances. And I kind of just started reading and I started reading more about the symptoms that these were treating. And I was like, oh my goodness, these are my children. Born with oral dysfunction, two very different, situations, but both oral dysfunction. And no pediatrician said anything. No, top three national hospital in Chicago said anything. So yeah, I started down the Airway path there, just kind of slowly.
well,
And
I
and
mean,
when I started,
to break it down, like for anyone that's listening or is maybe just jumping in and hasn't followed us all before, when there's oral dysfunction and the muscles don't work, most of the time babies figure it out. Now your son's case was so severe, but more often it's like your daughter's journey that they figure it out,
yeah,
right?
just
Humans are
compensation.
adaptive and compensatory, and they figure out
Yeah.
how to transfer milk even dysfunctionally.
Yes.
But from the earliest age, all of a sudden these muscle dysfunction, this muscle disuse literally changes the way that we grow. And
Mhm.
that influences the way we breathe. And it becomes this lifelong kick the can journey.
Exactly.
And it's not, you're right, it's not seen. Like people aren't zooming out far enough at the level that they need to be.
Mhm.
We're sitting here yelling, we're talking to Facebook mommy groups and we're on a podcast and we're teaching other dentists, but like we're so small in the vast ocean of medicine that it is so wildly overlooked. And
I know.
actually, even
I forget
poo-poo.
that sometimes. Do you? I forget that because like I feel like we do live in an echo chamber. Like how are there people who truly how has this not caught on
I
in the broader
understand,
medical
I
world?
spent a lot of time really mad at my colleagues because I got bitten by my bug and I had my own aha journey and my own personal intro to this. And you become evangelistic, you become
Mhm.
this adrenaline and power behind you to tell other people. And it was wildly frustrating because people didn't want to change because they have to be exposed to their own aha moment. They have to feel it from internally to make a change to the way they practice, the way they treat, and to admit that whatever they learned in residency or grad school might not be correct. And so that change is next to impossible. And
Mhm.
it's, I spend a lot of time angry at my colleagues. How dare you not change? How dare you not see what I see? And then I
Mhm.
realized I didn't see it either. You don't know what you don't know. What I don't understand, and I still get fired up about, is now, especially, I mean, this was, 10 years ago for your daughter, 8.5 for your son. I jumped on this journey 10-ish years ago. And now there's mounting evidence and there's tons of case studies and there's all of this stuff that is now supporting what we knew and see. And there are still people that are digging their heels in and saying, this is blasphemy, this is voodoo, this is woo woo. And that I don't understand. I understand not seeing it and not knowing what you don't know. What I don't understand is the the groups of people that are so adamant that what we're talking about is just garbage because we know it's not. We've been touched by it and we see it all the time. So I guess I still do have a little chip on my shoulder, but it's directed to the people that are fighting it as opposed to just not exposed to it.
It's hard. It's hard to admit that you've been treating patients wrong for however many years, isn't it?
Yeah, it is. I have a big, well, I just sold my dental restorative practice last fall, but in my office, I have a big quote on the wall by Maya Angelou that says, do the best you can until you know better and then do better. And it was because one of my mentors, Gary DeWood at Spear Education years ago, I kind of lamented to him. I said, oh my gosh, all I can think about are all the patients I treated incorrectly before today. And he said, and tomorrow you're going to treat them incorrectly because you're going to learn something in a month from now.
That's really good.
The best you can because it's overwhelming,
Yeah.
right?
Yeah. Yeah, that's a really good line. I agree. It- I saw hundreds and hundreds and hundreds of children in a family dental practice before catching on to the snoring and bedwetting and teeth grinding. I remember a lot of kids' parents being like, do you notice the teeth are shorter? And I'd be like, yeah, I mean, I've heard that's just a habit that they grow out of. Like, that's so sad. I feel sad that I said that,
Well,
but
we
I
were
really
taught in
didn't,
school, like anything we
I
didn't
didn't
understand was a variation of normal. Oh, that's a variation of normal. That's a variation of normal. Like it's
know.
not all a variation of normal.
At
And
some point, we have to call that abnormal.
and common doesn't mean or
Yes.
normal doesn't mean healthy either, right? Like just because it's
Yeah.
we're in an epidemic of
It's
dysfunction
kind of
and
a lazy,
poor growth, that doesn't mean it's healthy.
it's a little bit lazy, isn't it? But I was lazy.
Sure.
I didn't bother to go home and, so much as like Google teeth grinding in children. I,
Well, and there's so much
yeah.
misinformation out there too, right?
Yeah.
So you shared with this. Thank you for trusting me and sharing and trusting all of us to hear the story. It's just beautiful, and I'm so sorry you went through it. I can't imagine that your family's recovered, but I'm so glad that you went on to have more beautiful babies. Tell us
No,
how you transitioned from practicing dentistry to your wellness journey and getting to stay home with your babes, which was so important to you. How did you get there?
well, Airway was my open gate. And then once I saw that, I did start to kind of question everything. Like if they didn't talk about this in dental school, what else did they not talk about? And so I was like, well, what's the next easiest thing to put on the table? I was like fluoride. My husband has been telling me for years, like, what that's doing to your brain, right? And I'd always like roll my eyes and laugh. He's been crunchier than I am this whole
I've learned
time, but
that crunchiness is a spectrum too, right? Like there's different variations of crunchy.
I
I'm
agree.
moderately crunchy.
Like I just had a bowl of cereal before I came and talked to you. Like I'm moderately crunchy, but everything just kind of felt like it was on the table. And so
You
I
got curious. You decided, hey, I'm not going to blindly trust anything. I'm going to learn.
yeah. And because that's who I was my whole life, Maggie, just a lifelong student who just whatever you told me, I was just gonna regurgitate it back to you on a test. I was a good test taker and I think that's how I even got so far as to get into dental school when I really had no business doing so. I had no critical thinking skills. It really was my husband, Daniel, who kind of challenged me to start thinking outside the box. And so I started questioning things in dentistry and then I kind of started questioning things for our own life. And I still, I try to pick and choose what I care deeply about in our own home. I think just keeping it simple for us. Like I started saying like, well, do my kids need these applesauce pouches? So quickly I found, I think it was one of the Untethered very early posts. If you go way, way back, you had done a post about pouches. And I was like, oh, that makes so much sense. So I like get rid of all the like sauce pouches. Like it's carrots and apples for you.
What she's
So
what she's referencing is that when you use a pouch, and by the way, we have pouches in our house sometimes because modern busy
we
life,
have things that like
modern busy life demands convenience, right? And so you could go totally obsessive on any of these little paths, but in excess, using a pouch is going to use the wrong facial muscles and then it deters optimal growth. And so we wanted to do optimal growth. So using the baby-led weaning methods and chewing food is more optimal from that perspective. But we're also moms and you have to figure out simple, what serves us, what doesn't, what's going to cause me to lose sleep, what's going to, be an easy change, an easy shift. So
right. Yeah. I go back in my camera roll and there's so many pictures of kids with a pouch, an
mouth
almost
open.
2-year-old with a pacifier, lots and lots of the soft like puffs and stuff. But and it was very chronic in our house. And my oldest two kids, their mouths ended up showing it and needing quite a bit of expansion. So I'm still kind of you said like a wellness journey. I'm still kind of figuring it out. I think I'm much healthier. I'm much more like intentional about, especially like our food choices. I think that's the thing that we've cleaned up the most. Trying to eliminate a lot of the softer processed foods. Not just for like our oral health, but our overall health. And I think aside from the recent stomach bug that went through our house, I think that we've seen a big decrease in illnesses in the last few years. And you asked how I was able to start staying home with my babies because this has been the dream. I graduated from dental school in 2013 and I had it on my mind, crossing that stage with my diploma, like I am going to leave this profession one day. And I have so much
And I'm out.
I have so much respect now. Thank goodness I found Airway, Maggie, because Airway kept me in it for a long time, and I do think that I was able to help some families, and I'm really grateful for that. And I was able to help my own kids. They really needed a lot of help, and it led me to amazing people like you and Liz, and so many other Airway dentists. So I'm really grateful for what Airway did. It kind of saved me from any kind of like bitterness with becoming a dentist. But now I get to stay home with them, and we help providers, dentists like you and Liz, be more easily found by patients who so desperately need your services. We do marketing, build websites, do SEO, and things like that, so
You guys are
that
a dream team. And I will push back a little bit because you said you for a little while were able to help people. You are still helping people indirectly. And in fact, you're probably helping more people. And I had to have that kind of conversation with myself, like
yeah.
in my own mind,
Mhm.
by not treating patients, but by educating dentists and how to
Yes.
include airway
Yeah,
dentistry.
just saying that the other day. Like,
Start to spread it
yes,
wider, bigger, which is only going to help more patients, right?
yeah,
So you are doing that just in a
yeah.
different way.
There are people who can be in it every day, and it's unfortunate that you,
And thank goodness they can be. We need them. We need people that are going to stick in it or not have their bodies fail them.
yeah,
And I think we
yeah,
need people like us that can help
behind
grow
the scenes.
bridges.
Yeah, yeah. I'm more comfortable behind the scenes, I'll be honest. I like kind of standing, off stage and putting everybody else in the spotlight. It's fun, and I like what we do, and I like that all of our clients are so passionate about what they do. So it's been fun, and we're talking about like Instagram feeds from like 4 years ago. The goal was to make it very curated and pretty, and I
You
still
nailed
get to
it.
kind of do a little bit of like the make it prettiness, and that's fun for me. And I get to do it, after everyone's gone to bed or during nap time. I get to have, fun conversations like this. It's such a treat to be at home.
And and your content is really great. Like you're very good at it. If you're not following her, follow Dr. Molly Hayes on Instagram. The content is not only beautiful, but what you put out, I still find myself learning from you
Oh,
and incorporating
that is
how you
a
speak. I
compliment
will
of a lifetime.
take some of those words and use it to teach friends, family, patients, because you have a way of connecting with people that makes I am a
Thank
fire hose. I'm like a fire hose coming at you with a ton of information. You better fix this right now or it's going to be disastrous. And I've actually shut the door on a lot of people by being so off-putting that they didn't get the help they needed because of my intensity and my excitement. You have a way of being extremely magnetic and
you.
approachable,
So sweet.
and that message lands and helps more. And so I appreciate what you put out there and teaching how
Yes.
to
Isn't
serve.
it? Like, it's fun to bridge the gap for people, and I wish I had your brain, like to be able to like to see like the things that you are able to see and break down, but I just I'm I'm just right now just kind of having fun with online educating, because it is really fun, and it just seems like social media has changed so much. I used to be able to put out a post about like 3 signs your baby has a tongue tie, and now everybody's a content creator. And so
Everyone's a content creator and a course creator and a podcaster. Well, our brains work well together, so we can just pair up,
yeah,
share together.
that's true. That's
I love
true.
it. And you said something that you said you think you're still learning on this wellness journey, and I think that as a lifelong learner, we're both going to just keep learning. And I can't imagine like what we're going to say in several years from now, looking back at this stage of our lives. But um, I just think it's so cool. And I love that you get the time with your babes and that they're all around and they're also beautiful. And Daniel's great. You've been so wonderful for Liz and I to work with too, as far as
It's
being a
been
lift
fun.
and
It's been
also
fun.
helping us implement. We're great in ideas. We're running a million miles a minute, and then we don't execute or we don't know how to. And so you guys have come in with your specialty and just been able to help us get
It's it's
over
hard
that.
to say no to any of your ideas because they're all so good, and I think Untethered's going to take over the world pretty soon.
Well, I hope so from the
We got a
perspective of
whiteboard. We have like an untethered only whiteboard.
I hope so because I just think that like I hope that I'm around long enough that the inclusion of the simplicity of nasal breathing is at the cornerstone of wellness. not just at the public level, because the public is savvy. The public is out there
Mhm.
doing their research and listening to podcasts,
Mm-hmm.
reading books, but at the level that you were exposed to when your babies were little, at the hospital level, at the academic levels, at the graduate school levels, because it's so foundational to everything else. And there's still going to be plenty of problems out there. There's still going to be a need for medicine. There's still going to be a need for dentists, but
Yeah.
wouldn't it be wonderful if we didn't have so many fires to have to put out over and over again? So
So are you optimistic
I think so.
about, yeah.
I think I'm optimistic in general. I wonder if it'll be in my lifetime.
Yeah.
I hope so.
And we're young, so
Thank you for saying that.
maybe we're not optimistic, maybe we're realists, but I know it feels like it would be a stretch, right?
Well, but I think as like I remember Malcolm Gladwell's The Tipping Point. I haven't read his refined Tipping Point one, but I remember him saying like it's a slow progression and then it goes. And I think we could be on the cusp of it becoming much more mainstream, whether or not it becomes the standard, which is the hope. It's the obvious answer. But I think we are at a tipping point where more and more providers are going to take courses like what Liz and I are putting out, because they are, like you, touched by it personally and being like, something's not adding up. And then
Yeah.
once you see it in real life, either in your own family or in your own patient demographic, it's hard. You can't go back. You can't unsee it. And so I think that will slowly help the evolution of the way we practice, but whether or not it's really fast, I don't know. I'm hopeful.
Yeah. And isn't it interesting that it's kind of it's the mothers that are kind of pushing this forward? I on both sides. Talk about like the mama bears that come into your chair, sit in your operatory with their child, but like talking about the mothers, the female dentists who are kind of leading this, because isn't it interesting how we all have such similar stories?
We do. I mean, we all have our own personal stories. Some are much more horrific and impossible to imagine, yours, but we all have this moment or this connection that you can only see looking backwards. And I mentioned earlier in this chat that, I spent a lot of time angry at my colleagues because they weren't changing. And then I started putting all my energy, all this pent up energy that I wanted to teach people towards the moms and the patients. Well, now that's kind of coming back towards providers, because I'm starting to recognize the moms in the providers, and they're the ones that actually can help make the change.
Yeah.
And I think that it really will continue that way if the mamas keep chatting.
Yeah, I'm very hopeful on that front.
I am too. I am. Thank you for doing what you do. Thank you again for sharing your story. For all of you listening, go find her on Instagram. Check out our links in the post or the podcast notes below. If you like this, please share it with other mamas or other dads or other patients or providers, and help us spread awareness about how important early intervention and prevention is to not only oral health, but systemic health. Dr. Molly Hayes, thank you for being here today. You're just lovely. I could hang out with you forever.
Okay, well, let's do that.
Let's do it again. We'll come back and have a part 2 later.
Wonderful. Thank you, Meggie.
You're welcome.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this, and don't forget to subscribe.
want to learn more about Airway Health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.